We're seeing more and more Achilles injuries in sports. I think the thought is that athletes, as they become bigger and stronger and faster, have grown larger, but those tendons are still dependent on their genetics and can often get overwhelmed, resulting in an injury there. My name's Vijay Jotwani. I'm a sports medicine doctor at Houston Methodist. I specialize in non-surgical sports medicine, and that includes taking care of bone, joint, and muscle injuries for my patients, but also taking care of their general medical health as it pertains to sports and athletics. Unfortunately, an Achilles tendon rupture in an elite athlete will usually require surgery to be fixed and an extensive time of rehabilitation, usually up to a year before they're back playing sports. Sometimes we can get away with non-surgical treatment for an Achilles tendon tear, but usually in the setting of elite athletes, we need to treat that with a surgery to stitch that tendon back together again, and then an extended course of rehabilitation to strengthen the muscles and have that tendon working properly after it's healed. Often, an athlete will take 1 year or more to recover fully from an Achilles tendon tear and be able to return to the type of high-level sprinting, cutting, and pivoting activities that are a part of soccer. We always worry in Achilles injuries about the potential risk of the injury happening again, but fortunately with good rehabilitation and the excellent surgical techniques we have, that's fortunately quite rare. And once an athlete's recovered, we're not usually worried about any long-term effects from their previous Achilles injury.